Hello and welcome to our discussion today. My name is David Culver. I am here with Lynn, Bournia, Denise, Hazen, and Carolyn. And today we are going to be discussing fetal alcohol spectrum disorder. So what is fetal alcohol spectrum disorder? Now this is a group of conditions that can occur when a woman drinks during pregnancy. Now this spectrum can include partial fetal alcohol syndrome, alcohol-related neurodevelopmental disorder, and alcohol-related birth defects. But the most severe form is simply known as fetal alcohol syndrome. Now, this is not an official diagnosis recognized in the DSM-5. However, it is in part of the manual as being an area that requires more research. And it is labeled currently as prenatal alcohol exposure. Now, alcohol has several effects on the fetus. During the first trimester, alcohol impacts brain cells. And in the second trimester, you begin to see facial deformities appear. Finally, in the third trimester, it impacts the hippocampus, where the brain's long and short-term memory is stored. Now, while there are some physical signs of FASD, many children may only be diagnosed through the social and learning difficulties that they face when they enter school for the first time, such as hyperactivity, attention issues, and social difficulty, including being unable to anticipate consequences, having poor judgment, or poor physical coordination. And here we have an image of a FAS child where you can see there's some physical signs such as the small eye openings and a thin upper lip. Now, why is it important for us counselors to understand fetal alcohol spectrum disorder? Now, although it can impact anyone regardless of their income and cultural background, it is most often found in homes where parents frequently abuse drugs and alcohol, are abusive towards their children, domestic violence, and families where children are removed frequently from the home due to these abuses or maybe some other abuses. There's also a disproportionate number of minority families that are affected. However, researchers aren't sure exactly why this is. And counselors need to understand these signs in order to make an appropriate diagnosis for an affected child. Now, it's important for us as counselors to get a history of the mother's habits during the pregnancy, because some of these symptoms can also be found in other conditions such as Down syndrome, ADHD, as well as it can have some similarities to mothers who may have taken the wrong medications during pregnancy. Now, some of the signs of this disorder, besides the facial abnormalities that were shown in that image previously, diagnosing FASD, again, it requires us to take a history of the mother's habits during pregnancy, as well as recognizing distress or impairment in social, academic, occupational, or other areas where we as people just need to be able to function. And we also need to understand how this disorder affects children as they grow up. If this is not treated, the stress of FASD can lead many adolescents and adults to suicide, and mental health problems have been identified in more than 90% of individuals who have suffered some form of prenatal alcohol exposure. Now I'm going to go ahead and toss this over to Carolyn, who's going to be discussing the impact of FASD in minority populations.
Thanks, David. FASD is relevant to minority populations because minority and low-income populations have some of the highest rates of FASD in the United States. The rates of Native Americans born with FASD are 1.5 to 2.5 per 1,000 births. The rates of low-income babies born with FASD are 2.29 per 1,000 births. Middle to high income rates of babies born with FASD are 0.26 per 1,000 births. Armstrong and Abel state that higher FASD rates in low socioeconomic populations are not due to the fact that these individuals consume more alcohol, because alcohol consumption is actually higher among middle and upper class women, Instead, they believe that FASD is more pervasive in minority and low-income populations because other factors such as smoking, drug use, and poor diet intensify the effects of alcohol. With high rates of FASD in these populations, the impact and consequences are important to note. Children and adolescents with FASD have an increased risk for delinquency behavior. This can lead to eventual incarceration. Surveys show that between 15 to 20% of juvenile and adult offenders have FASD, but this is likely a low figure because most cases go undiagnosed. Parents and society in general are more likely to attribute an individual with FASD, their development issues to social class, culture, and non-nurturing upbringing. This is known as cultural overshadowing, and it is a common problem in our court systems. Often the competence of a poor minority defendant is not associated with the effects of their disorder, especially if undiagnosed, but recognized as a consequence of their cultural factors. Woods, Greenspan, and Agarkar make a compelling argument that lawyers and psychiatrists need to recognize the role that alcohol-caused congenital brain impairments play in a defendant's case so that all relevant factors of their function are considered, not just the stereotypical ones. Another impact which creates a cyclical problem for those with FASD is the inadequate amount of screening, diagnosis, and treatment for minority and low-income populations. Oftentimes, these populations do not have adequate and regular prenatal care or education about the effects of alcohol on a growing fetus. Once the baby is born, the amount of screening from a physician that takes place is minimal. This leads to no FASD diagnosis for the baby, which means no treatment prior to the child entering school. This can lead to delinquency, and the cycle can continue. More screening, treatment, and education is needed in these populations. And now we'll move on to Denise, who will speak about treatment, interventions, and strategies.
Thank you, Carolyn. Throughout development, individuals with FASD will benefit from counseling interventions. The earlier that these interventions can begin, the more effective they will be due to the neuroplasticity in early brain development, which suggests that some of the brain damage done by the prenatal alcohol exposure may even be remediated. Maternal alcohol usage may lead to malnutrition, which exacerbates alcohol's effects on the fetus by restricting nutrition. Some studies have shown that nutritional supplements given prenatally and postnatally can help to diminish some of those negative effects. Once the damage from alcohol usage has been done, postnatal interventions such as motor and sensory stimulation can provide beneficial effects on the developing baby. Hyperactivity, attention issues, and social problems are the most common characteristics seen in children with FASD. Individual and group play therapy are effective at helping these children cope with behavioral, developmental, and emotional issues. They have shown to be most effective if done in conjunction with a parent or caregiver because the therapy is reinforced at home. Mary J. O'Connor and colleagues developed an evidence-based parent-assisted social skills intervention specifically for use with children with FASD called Children's Friendship Training. It's implemented in conjunction with a parent or caregiver in a group setting over the course of 12 weeks with 90-minute-long weekly sessions. Reinforcement is done at home by rehearsing skills, having playdates to practice those skills, and parental coaching during peer interaction. FASD is often multi-generational in nature, so many birth mothers of a child with FASD likely has some prenatal alcohol exposure themselves, leading to cognitive difficulties. This, in addition to parental shame, is a big reason why there's not as much early intervention as there should be. Even with early intervention, individuals with FASD will continue to need counseling services throughout adolescence and adulthood. In adolescence, social problems grow in intensity, and the onset of puberty adds additional challenges to an individual even without FASD. Young people with FASD lack the skills to create healthy friendships due to the cognitive difficulty of understanding boundaries and anticipating consequences, along with the added impulsivity that's natural to this developmental stage, but that is intensified with FASD. Group therapy is useful to this population at this stage of development by helping the individual with topics such as risk-taking behaviors, appropriate sexual behavior, social skills, and even hygiene. This type of intervention has shown to decrease mental health issues. Pharmacological treatments should be used as a secondary intervention to therapy because this population does not always respond to medication as expected due to the damaging effects of the alcohol exposure. However, one study showed that individuals with FASD were on nearly twice as many medications as their counterparts to treat secondary symptoms, such as ADHD. Even as an adult, the individual with FASD will likely need counseling interventions such as mentorship to assist them with transitions into employment through work experience. In addition to helping the individual with FASD, the families caring for them will also benefit from counseling services to support them through the challenges of raising a child with FASD, as well as training them to assist with interventions at home. Parent-child interaction therapy focuses on the parent-child relationship and behavioral interventions. Parents participate along with their child in 90-minute weekly sessions for 14 weeks. The results of this therapy were that there were fewer behavioral problems for the child and parental stress was reduced. New Choices is another program designed to help a child with FASD by focusing on the mother who has a substance abuse problem. This attachment-based intervention resulted in improvements in symptoms of depression, gained empathy, and social support in addition to the child's social development. And now I'm going to pass this on to Lynn, who will discuss our personal perspectives and what the future holds for FASD.
Thank you, Denise. What does the future hold for fetal alcohol spectrum disorders? Our team concurred that these disorders can be eliminated if expectant mothers did not use alcohol during fetal development. We also agreed that this is not always possible. We are requesting more research to be performed, both prenatal and through the development of the person affected by the syndrome. Our personal perspectives are for education, early identification, and interventions. This is especially true when working with high-risk clients to achieve health equity. Communication, education, and screening are all important ways to identify and reduce the risk of FASD. Educating women of the dangers of alcohol and the importance of proper nutrition during pregnancy should be addressed during family planning and prenatal visits. Developing and utilizing proper screening tools during infancy are key so that early interventions for attachment can be utilized. FASD becomes a health equity issue and is a concern especially when working with minorities. Screenings for these populations are vital. Further research is especially necessary in regard to those treatments and interventions already mentioned, like motivational interviewing, play therapy, group therapy, and animal-assisted therapies. There is very limited research available on animal-assisted activities, and our group would like to see more research done in this area as well. Without these elements, we are doing a great disservice to this population. With proper diagnosis and treatment, children with FASD have a greater chance of overcoming obstacles they will face during their lifespan. Through proper understanding of the limitations surrounding FASD, we can possibly avoid future incarceration and potentially stop the cyclical nature of the disorder. Given the fact that there is no known minimum amount of alcohol that a pregnant woman can consume, the authors of this paper agree that the best and only proven outcome is for a woman to not consume any alcohol while attempting to conceive or while pregnant. We appreciate your time, and we hope you've learned a little more about fetal alcohol spectrum disorder. Our references follow.